Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. This patient has a history of unexplained weight loss, and they mention also that there is fever of unknown origin. She is 59 years old. So this is the non-contrast images. Then this patient did CT with contrast as well. So this is the post-contrast CT. Maybe you note that there is hepatomegaly, and we check the rest of images. So I will show you now the post-contrast like in different phases. So I'm checking for all the images in this case. So maybe you know, there is some like prominent gastric projection here, and in this case you can also describe that there is perinephric stranding. So going through these cases like many times, I think you'll maybe note something here. I'll try to show you all what I check. So I try to find the like explanation for why this patient have like unknown fever, which is difficult to question. But when I check the CT, I find something maybe is important to check as a good checklist, that through the kidneys that we have to check for all the parenchyma changes. And if you agree with me, I will show to you now. If you adjust the window, you'll find there is something different from the normal renal parenchyma here, and in the other side as well. So they are bilateral changes, and if you agree with me that there should be here something. So I go now back and I will show you in the images, is it like true or no. So through the other phases I would try to show you the is it true or no. So here if you you'll find that the renal parenchyma is fine, but when you go down you'll find that there is something different, and here as well. So now there is differential, we have to think about what it could be. And the patient as presented by fever of unknown origin and weight loss, what could be the answer for that? So I check the differential in this case, and I find that starting from the neoplastic process like lymphoma, it could be as a differential here, and also the types of nephritis that can do this as well. So the vasculature in this case is most no significant abnormality here, and also no lymphadenopathy. So still there is a big differential, but the teaching or learning point that I think that could be helpful here, if someone see this case, I think that they need to check the kidneys in systematic way, and especially when you have like a big question like that question, how you will explain the fever of unknown origin. So sometimes it can be subtle, and the kidney is one of these important organs that we have to check. So as you can see, if you didn't make effort to check the windowing and to check it clearly, maybe you'll miss these lesions. And I hope it could help the patient to know what he have in this case. Was it interesting? I think it's an interesting case.